First start in this series is we're going to start from the ground. So let's go ahead and get there. You're going to start in what's called an SI joint rotation. So to do these, you're just going to lay your back completely on the ground. The important thing to note is to keep your shoulders firmly touching the ground at all times. So as we go to twist and rock, you don't want your shoulders doing this or this. You just want them firmly on the ground and this lower segment to be what's moving. So going into that, you're going to take your heels, put them together, put them up by your butt, right? Not all the way up, but just, firmly, comfortably. From here, you're going to go into small circles and just wiggle a little bit as your mobility will let you. You don't want to be hurting the back or the spine. You just want to kind of do small circle rocks. And then with each pass going back and forth, right? You want to make your motion a little greater. So now I'm rocking a little bit more, a little bit more, a little bit more. Notice my shoulders are never leaving the floor. And then I'm just going to start getting into bigger swings and bigger swings. And this isn't all in one day. This is gradually over time. So if you can't get all of this in one day, then it's fine. Do it in week progressions. This is all a progression step. So eventually, though, you're going to want to be doing it going all the way touching one side, all the way touching the other side, right? And I would say if you're doing this exercise daily, do this for like a set of 20 or 30, but this exercise itself isn't really so much a like sets and reps exercise as it is a feel-good exercise. So just do it until you feel your mobility and the spine really open up and you feel things like moving and grooving more. So moving on from that one, you're going to do another one that's very similar. So you're going to straighten out your body again, shoulders touch the floor. They never leave the floor. So straighten one leg out. The other leg is going to come up straight as well. And you're going to bring it over to the cross on the other side. And you would bring it back up and you would bring it back down. Something you can do is have a partner or someone else kind of like throw your leg. So they'd be up here and they'd push your leg down. So your job then would be to raise your leg up here, but they would be throwing it down here. And that would be something to do if you can't do this one. Like the ballistic nature that we're getting into, if you can't do that, that would be a good option because it would help teach you that. But at first, we'll just do, passive motion, do this guy, do like 3 sets of 10 on one side. When you do that, do 3 sets of 10 on the other side. Don't do those sets all at once, alternate. So do 10 on one side, 10 on the other side, 10 on one side, 10 on the other side. Alternate like that to give your spine a break, right? And then, so that would be the beginner progression. And then as you progress more into it, as you need more from that exercise, then you're going to bring your foot up, bring it over, and then rebound like this. So I'm letting my foot fall, and then I'm like resisting it and springing it back up. What this does is create torsion on the spine, and it'll act as kind of a self-adjustment exercise. Okay, so the next one, I don't super have a good name for this one, but we're just going to call it pushing your lower back into the floor. So this one might be hard to see or difficult, so we'll expand on this one a little bit. So just laying in this position, shoulders ideally will be touching the floor, but if you need to bring them up to feel the engagement of this better, then that's fine too. Your feet should be, let's see, about right angle, about here. You want something. You don't want to be all the way back because that might keep you arching in an arch position. We want to kind of be long. So what we're going to do is you'll see the smaller your back here, right? Let me see if I can pull my shirt back a little bit so you can see like daylight under there maybe. Hopefully you can. So plant the butt. You could put your hand under here. What you want to do is take your lower back and crush your hand in that. So if you're using your hand, sometimes this could be uncomfortable. If you wrap a towel or put someone else's hand under there, that'll be a better cueing. So the whole point we'd put a towel under here is just for cueing purposes, just so you have something to push against to help you feel you're doing the motion more correctly. But yeah, you're just going to crush that hand and eventually you'll be able to remove it. And all it's going to be is crushing down that low back into the ground. And when you get that crush, then you're going to hold it for like 10 seconds. Ideally, it would be 30 seconds. But if you could only get 10 seconds at a time, 5 seconds at a time, totally fine. Just work up into it. And so this one's definitely going to be more of a sets and reps game, but your reps are going to be through time. So I would say do 3 to 5 sets of lower time. So if you're only doing like 5 seconds, you may want to go up to like 8 sets of 5 seconds. But if you're going to 30 seconds, then I would say go to as high as or as low as 3 sets of 30 seconds, because your overall time, you don't actually need that much. It's going to be pretty intensive. But what you're doing is trying to create a neutral alignment in the spine. So if you don't have very good spine mechanics or control, you get to this butt out, hips coming forward type of thing. What this exercise is doing is bringing your butt in and your hips up, right? So instead of them falling down, they fall up. And what that does is it stacks your spine more neutral, and it helps take a lot of tension and strain off those QLs by the front abs adequately like supporting your structure. So yeah, moving from there, we're going to go into the side leg raises. We have 2 variations of this: a side leg raise isometric and a concentric version. So what that's going to mean is you're going to need a partner for this one. And if you don't, you just hold it. That'd be fine enough. It'll just take a while. So you go from the side angle, right? You want to get as straight as possible. And then you're going to take this leg and you're going to raise it up like this, right? And you can, if it's just you, just hold it here. Hold it here for like 30 seconds or until you can't do it anymore. I'd say 30 seconds would be plenty. And then you switch to the other side. You do the other side, right? Now, if you have a partner, you would hold it up here, and then they would grab and push down on your ankle, like right here, or maybe your knee. If the ankle's too easy, if they just like push it and you like immediate give, push on the knee, right? Work up the chain. So they would push, you would resist, and you would do that for as long as you can. It could be up to 5 seconds. It could be up to 30 seconds. Either of those is good. You just need to do it. Go for about 3 sets or 3 rounds of this, and then do alternate sides. That means, do this, do one side, get done with that, switch over, do the other side, get done with that, and then so on. Moving on from there, you're going to go and do the same thing concentrically. So what that means, same position, same movement. You're just bringing your leg up, down, up, down, up, down. Something to note, if your foot is too far forward and you're doing this is going to be easy. You can do it for days, right? Just bring your foot back a little bit and play with it. If you bring your foot back too much, that's like hardest thing you'll ever do, right? So this is the easy mode, foot back behind your heel, or the more back it goes, actually, that's the hard mode. If you bring your foot back too much, you'll like feel yourself pulling over and falling back. Totally normal. It's just how mechanics work. So yeah, just bring it back far enough and then raise from that angle. But I would say all you would really need is, if you catch yourself with your foot forward, just work and try to get your foot on top of your other foot the whole way through, right? So when you get to the concentric portion where we're not resisting, we're just going up and down, go as high as sets of 20, like 3 sets of 20 on that one would be fine. Moving on, we're going to go into hollow holds. So this will be a fun one. So hollow holds are going to be, you're going to take your hands. You don't really have to do this with your hands. The hands is a counterbalance thing. But you're going to take your hands and put them back here. You're going to take your feet, bring them up, and then go forward, right? As you go forward, you want to push your lower back, really push that, or at least try to, into the ground, kind of like we were doing in the third exercise, where we're just punching it into the ground, right? So you're going to do this, and just hold it there. You're going to hold it there for about 30 seconds. If you find yourself unable to do this, we're going to actually break apart the exercise a bit and go into a dead bug. So hollow holds is what we want to do. That's the ideal best bang for your buck exercise for what we're trying to do with the low back. But if you can't do that, you need something to progress from, move over to dead bugs. So what dead bugs are going to be, you're going to start in this position. You're going to bring both your feet up, and you would go like this, right? This is a dead bug. If you don't want to mess with the hands, it's totally fine. They don't do a whole lot for your actual problem with your low back anyway. The magic of what we're actually working here is the legs. So you could put your hands behind, do something like this, or you could even do something like this, right? This one's really kind of just move these legs, move your hips, go through an elongation and a flexion at some point. That's all we're really trying to do here, because any capacity of this will build up into that hollow hold that we're looking to do. Right. After that, we're going to move on into a plank. And so a plank, we're going to get up in a push-up position, kind of like this. You're going to put both legs up, and you're just going to hold it for as long as you can. I would say go 3 sets of 30 seconds, and just hold it here, right? If you can't do 30 seconds, do 10 seconds. The only thing we're really looking for in the plank is that we don't have this bowing out of the low back. So what that's going to look like, what we don't want is something like this. What we want is that butt up and the hips stacked. Moving on from there, we're going to do a psoas stretch. What that's going to look like is, how should we do this? We'll go front view and inside view. So front view, this turf really hurts my knees, by the way. This front view is going to be in a lunge position. From here, you want to kind of like lean forward into this knee. So you have a stretch on this hip, right? From that stretch point, you're going to take this hand and then kind of gently rotate towards this side, right? We're just going to go kind of slow. And you can kind of like pulse it a little bit even. But as you do this, as you go to stretch and you're like, oh, I can't stretch, pay attention to this hip, because it might try to pull back to get more range of motion for this stretch. Everything is kind of like a rope. So if we're here, rope's tight, you're trying to pull the rope even tighter by rotating, right? And if you are like doing this and you're like, oh, this is easy, check and see if you have enough tension back here, because oftentimes what will happen is you don't even know it, but you just back up to compensate so your body can go through the full range of motion with this rotation. But this is like the first lock. This is what you want to get. As soon as that starts to let go, you get more elastic with it or flexible with it, then that's when the rotation really comes into play. Another thing we can do from this position is, like when you bring it up here, start to pulse just a little bit. So get it real tight and just pulse a little bit. Like don't force it too much, because we don't want to initiate or aggravate a pull, but you just want to like sit into it and then pulse, and then that will actually help open up and pull those things apart a little bit better. Here's what it's going to look like from a side view on the other side. So lunge position, go into this knee, right? Feel that deep stretch in here, bring the hand up, and then rotate. But remember, as you rotate, you want to make sure that you're leaning into, this is stretched out, you're leaning into this side, right? And it's not a drastic leaning like anything like this. It's very, very subtle. So very small motions. So if you're making anything like overly compensated or making very large movements on this stretch, on the psoas stretch, then it's not, that could be like an indication like, oh, maybe I'm doing this wrong, let's back off a little bit. Everything's very subtle. So again, what that's going to do is stretch out the psoas. It's this big muscle leaning over here. If it's tight, it often clinches the back, so that we're doing the butt out, hips falling down motion. So this is just to unlock your hips so that they can move in a better plane. After that, we're going to go into our standing exercises. All right, so moving on to the standing portion. Don't mind these sandbags. They're not going to bite. But the first one we're going to do is a QL wall stretch. And to do that, we're just going to find an empty wall. It could be on a power rack. I'm trying to think at home. Maybe a doorway, something like that. You don't want to do it against glass. You'll break through the glass. But you're going to take your elbow or hand. So you could totally do them this way. I prefer to do them this way just because it's easier to get resistance. But if you wanted to do it this way, you totally could. So how we're going to start is elbow goes in. The foot that is closest to the wall, this one, is going to come forward. This actually matters, because if it's not this way, if we go this way, this hip's kind of locked up. Like this side's kind of locked up. We're not really able to stretch it a super whole lot. But if this foot comes forward, the muscles that we're trying to stretch in the side chain, like they're exposed now. They're kind of like load bearing, so we can put that tension on them. So then what we're going to do from this point is we keep a straight line. And so from this position, we stay straight. From this position to this position, so from like the top of the, or bottom of the sternum to the top of the hips, this mid-gut section, we're going to try to bend into the direction of the wall. So how we're going to do that is we're up nice and tight. We're going to drop our hips and gently just kind of like fall, but notice this part. I'm trying to keep straight up in here, and all of my bend is coming down through here, right? So we're just going to hold that for a little bit, and then we're going to contract the side. So we contract it, we get back upright, and then you lean back in again, right? So you fall in, ooh, it's a deep stretch, and then contract. Be sure to breathe when you're doing all of this, otherwise you pass out. So back in and back up. So yeah, you could totally do that with your arm this way as well. Another thing to note is the more closer to upright we are, like this, and if you're doing it, it's going to be it's like less body weight on the exercise. This is kind of a body weight exercise because we're at this angle, we are forcing weight into it. But if you're in this position, it's less. But the further you go out, like if I'm out like to here, I'm putting a lot of weight on this QL stretch. So from a back position, or maybe the other side, it's going to look like this. So up nice and straight, let the hips fall into the wall, and then back up. So yeah, hopefully you can see that from the video and this makes sense. The next one, we take from it something called a 7-way hip, and it's this, we'll cover it eventually, not right now though, but we're going to modify that into a standing 3-way hip. And so what we're going to do is grab our wall, you can grab a chair, counter space, doesn't matter, but something to stabilize you for sure. Then from the standing position, you're going to raise your leg forward, hold it, side, hold it, kick back, hold it, right? So this is the exercise we're doing, and you would do this for like 3 sets of 10 per each. It's kind of a high repetition exercise, but if you fatigue out, you don't get your 10 reps, don't worry, it's no big deal. You just want to like build up to 3 sets of 10, but each direction, forward, side, backwards. So this is 1, 1, 1. That would be 1 rep. That'd be like 2, 2, 2. That would be the second rep. So the standing 3-way hip, you do that on both sides. I'm trying to think anything else with that. Oh yeah, something to note, we don't want to go into the swinging thing. If we're swinging like this, we're using momentum. That's not what we're trying to do. We're actually trying to isolate the musculature in that glute med, and mostly just the glutes and entirely, and really trying to kind of like build those so then we can do this from a laying position. That's the progression. So for this one, we definitely want to be very conscious and focused on control. Yeah, so I think that wraps up all those exercises. Let me know if you have any questions on any of it. And so this is progression 1. All this can be done at home in terms of sets and repetitions. If you just wanted to approach this as a flow and just do every one of them until you feel kind of like you've burnt out, or you're just kind of done with the capacity for doing that exercise. Like you do the standing 3-way hips and you're just like, I'm done with this exercise, right? But you've already done like 20 repetitions each. That's totally fine. So if you wanted to move with it through a flow, that's like everything's 1 set of 20, something like that. You move on. That's totally fine. If you wanted to go through and use it as like an exercise regimen, where you're like, no, I'm doing 3 sets of this of 20, 3 sets of this, and so on and so forth, having more structure, that's totally fine too. Either way is going to work, but what's most important is that you just consistently do this. It can be done every day. Perhaps you should do it every day for about 3 weeks. After about 3 weeks, we're going to come back. We're going to redo all of this, and then we're going to do lower back progressions too.